healthyzenji.com will be launching Nigeria's first health podcast, which we call it Afri Health Podcast, and it will be available live on our platform. We'll be talking about medical developments in the profession. We'll be talking about information, and of course, we'll be taking critical look at different health conditions, in order to inform medical professionals about the latest in their fields, and of course, members of the public that have underlying conditions will also be able to know the best way to prevent, manage, and of course, cure or treat the medical ailment that they have. It's going to be very unique because we are not just talking about, oh, this is a regular disease, this is a person, but we are looking at health conditions from a very broad point of view.
This year's World Health Assembly, for instance, had as one of its major themes was the criticism that the World Health Organization received over the Ebola crisis and its perceived failure to act quick enough.
According to global planning for disease control, there is no space for social media as a tool. So, professional communications, citizens engagement, feedback, even for surveillance, we realized social media could do that. So we told them that, look, we will sort out this. They don't need to worry about the process. We will talk about it, we'll deal with it, we'll use our resources to run it. So we set up the social media service primarily to communicate first. Then we realized that when you communicate effectively, one of those things we can do is also get feedback, especially from the three classes of people we have to deal with: the cases, the contacts, and then just general population.
I was part of people that responded, the first 2 nurses that responded to Ebola outbreak in Nigeria. The success rate we had in Nigeria was because a lot of people, I worked here in Nigeria, I took care of Ebola patients in Nigeria, I also worked in Sierra Leone. So I could see the difference between what happened in Nigeria, our success story, Liberia, and for the 2 months I spent in Sierra Leone. I was in 4 months in Liberia and 2 months in Sierra Leone. The difference in Sierra Leone, we're having 60 deaths per day. Every day I come to the ETU, at least I see 60 cops. Now, what the difference is, just like some places in like Green Jida, some of these places I stayed in Liberia, they don't have access to the internet. Even the ones who have access to it, they don't even know how to use it. They were living in disbelief. Apparently, they don't have access to information. Of course, in Nigeria here, almost everybody has access to internet.
Rumor flows very quickly. So you need to have information that is trusted and credible to counter the rumors that are going out. And this is one of the key areas that we were able to work on.
When using social media, has anyone come up with apps that are language or culture specific? So to inform the population about certain illnesses or diseases or conditions.
We provide localization services. For instance, if you have a service that you want it to be in local languages, or maybe, let me give you a particular example. We did a similar service for Chevron. They created a website for health information. That was in the UK, global website. So we did the localization of the Nigerian content or conditions that Nigerians are quite familiar with. A very major hospital in Calabar wanted to launch their website, and they wanted content. So we did content development for them. So we offer that kind of services to the best of our ability, because our team is made up of healthcare professionals. We have medical doctors, we have medical scientists, all members of our team. So that's what we do professionally. Many hospitals have websites, but none of them has really quality content on their website. So we can develop content for you, and of course, we can help you with a technical point of view.
If, for instance, you're writing for a product, and all of the writing that you're doing is just, educating the public about medical issues, hypertension today, dysmenorrhea, and it's not as if you're, certifying the product or saying that, oh, this product is better than that. What are the rules about that? If they offer to pay you, what are the rules about that? Then the second question that I have as well is, are there rules or guidelines or ethics that guide the type of work or the type of material that you put out there?
Now looking at it from the editorial points of view, we on our platform we have content, sponsored content. Companies across the world will just say that, okay, want to push this, want your audience to be informed of this content. So what we usually do is if there are content that we are writing on our own, you would see the name of an author below directly as the author. So you as a person, it could be, first of all, you have to declare. First declare, okay, I got this, whether it depends on where you are putting it. Okay, I got this particular support from this particular company, they are paying me so and so. Let that go, let that information be out there, then you keep your audience informed about what you are doing, depending on the format. You know the challenges that we face. You know the limitations, the shortcomings of Nigerian healthcare system. Which specific spaces do you see social media and other tech innovations playing in order to help Nigeria to achieve the desired health goals?
That's a very serious question, because innovation is kind of very broad and really. But if you look at maybe the biggest problems we have right now, I think tools of advocacy will be very important because citizens actually need to know what's going on. There's a new health act, for instance. People don't know anything about it. So we need a lot of information to start with. And that information must really connect. In terms of advanced things to do, I think areas of affordable diagnostics will really be very useful. A lot of work has been done in terms of mapping out areas of opportunities for innovation in Africa. One of the areas is medical education. So if you are here, I'm looking at one of my teachers in school right now, you might want to set up a school of postgraduate or undergraduate training, specifically maybe for after school or, CPDs, continuous professional development. Population is rising, but for instance, look at Nigeria. How many medical schools, dental school, nursing schools do we have? By 2050, we will be 300 million. We need to match up. So there is a major need for innovation in education in Nigeria.
You're trying to get people to engage with you. You're trying to get people to respond. So you need to make sure that they understand what it is you're saying. Does that make sense?
Yeah,
we can go through tools, but you have to make sure you break down the information so that they can absorb it, engage with it, and respond appropriately, which is what people are trying to do with the National Health Act. Break it down. What is inside it? What is your right under the National Health Act? How can you use it? Because what that will actually do is allow Nigerians to begin to hold their government accountable to the things that their government is supposed to do. If they don't understand what's in the medicalese, they can't hold government accountable.
What do you think should be done in order to address the anomaly in which people talk about patient information online? How do you think, what is the current status to your best of knowledge? And of course, what do you think we can really do to facilitate this issue?
Well, I've been in the field the last 10 years. The situation was bad 5-6 years back, where you see nurses, colleagues I know, pasting pictures of probably 2008-2009 when Facebook was, they written. You could see people pasting pictures in a theater with patients. I had a picture I saw during Christmas, so holding a patient very ill and it's not taking a selfie and all that. It's beginning to drop because Nigeria is changing. The public is becoming very much aware about their rights. There is a whole lot of interaction. That's credit to social media. They now know their rights. They know they can sue you. And of course, people are beginning to lose their license. So they're beginning to read and see their colleagues in the UK who lost their licenses, who were sacked, who probably went out of jobs. So the awareness is there. They are becoming more enlightened thanks to social media. The way forward, I think, it's just to keep educating people. That's why we have people like Newswatch and your organization putting this information out there, creating awareness. Look, you can lose your job, you can get fired, you can lose your license if you indulge in these things.
Nobody wants to be sick. Nobody wants to be in hospital. And if you go to see your doctor or your physiotherapist, your occupational therapist or your dietitian, whichever clinician you go to see, you want to be treated nicely. The patients coming to see you are not well. Don't sit there and be unhappy because the patient can tweet, oh, I went there and he was grumpy. or I went there and it was abrupt with me.
It should be that there is one standard of medicine across the entire country. You should think when you are sick, especially in an emergency situation or some sort of catastrophic accident, I should go to the closest doctor, not the best doctor, because they all should be capable of handling the injuries that I have or the illness that I have. But from what I hear, at least from some of my Nigerian colleagues, is that that's not necessarily the case throughout the country. And social media, what it can be used for and what it can be used for very well, very quickly, is to make sure that the government knows that this care is not being delivered. So it serves as a monitoring system for the government and state hospitals by the population.
They should be able to put these things in place. That should be in routine now, like drill. So if something like this happens, epidemic, what can we do? Put some things in place, train personnel, send them for trainings, and then put some equipment in place so that should you have an outbreak of any sort, the response can be almost immediate.
The truth is that social media will play a role in the entire healthcare value chain. So it is now left for building capacities to apply it, and also those capacities growing interest to go ahead and do it. So it is now going to be a lot of work on those who might want to take responsibility for the governance of the process to ensure that because it now shows, if you can look at those things have dropped, capacity building is a lot of work. You need to now grow interest in it, train people, get them to go out there, or people who are already trained abroad or locally, moving into this space and supporting it, because it is a cost indirectly. We look at it as an industry, because what it will do for us is that, like most technologies, it will help us minimize the time that can be spent, in tackling some of these issues. Like I spoke on stage, advocacy from education, diagnostic, logistics, coordination. Those are really, really serious issues. And social media has a role to play in all of these things. It just now requires people to come into this space and play their own role.